There are four basic levels of variable measurement that we can use, and they describe different types of variables. The first kind of variable is a variable that just names things. We call it a nominal variable. And a variable like gender is an example, where we have attributes of gender, male or female, and those are just names for categories. They're not ordered. There's not some hierarchy of gender. There's just names of things. So race and ethnicity would be an example of a nominal variable. Gender, as I just said, is an example of nominal variable. What type of clinic do you go to is an example of nominal variable. Anything where we're naming things rather than creating a hierarchy or an ordered list are considered nominal variables. But often we want to order things. So I'll ask a question like, how is your health? Is it excellent, good, fair, poor, or terrible? Well, those are ordered, and we call this an ordinal variable. So variables where there is an order to the variable. So age, if I have age categories, 1 to 5, 6 to 10, 11 to 15, 16 to 20, those are also ordered. They get older as you move up. But unlike age, which I just specified, the variable for health doesn't have any interval between any specific interval. As you move from good to fair in terms of health status, there's no specific amount you're moving. It's just sort of a qualitative assessment. It's ordered, but there's no clear number line. If you move from a category of age from 5 to 6, you're moving a year unit. And those variables that are both ordered and have a certain amount of value associated with them are called interval variables, when the distance between the attributes have meaning. So we've got ordered variables where there's no meaning of the distance, there's no specific number associated with moving from good to fair in terms of health status. When you move from 6 to 7 years old, there's a year difference. And so as we move up in attributes, we go from ordinal variables, which are just ordered, but which the difference between the orders don't have a numerical value, to interval measures, where there actually is a meaning to switching from category 1 to category 2. And finally, there's ratio measurements. And these are when you have counts or other measures that have a meaningful zero. And the reason why the meaningful zero is important is mostly for statistical reasons that we're not going to talk about, but the book also mentions ratio measurement. So for most of the things that we're going to do, interval and ratio measurements are going to be fundamentally the same, and I'm not going to ask you to describe the difference. But the key is that we have variables that just are names, for which no order has meaning. We have variables that just have an order, but the numbers don't mean anything. And then we have a set of variables that have order and meaning in terms of the numbers we ascribe to the attributes. You can see over here a table that outlines our nominal, ordinal, interval, and ratio variables by a set of attributes they have. Are they ranked or ordered? All of them are except nominal variables, which have no rank or order. Is the distance meaningful? Is there the same distance between each category? Not for nominal variables because they're not ordered, and not for ordinal variables because there would be interval variables if they had that attribute. So interval and ratio have that, and then is there a meaningful zero, and that's only ratio variables. The reasons why these levels of measurement are important is mostly because they determine what statistical test is appropriate. And when we get in a couple of weeks to quantitative measurement, we're going to come back to these questions of order to levels of measurement. And we'll find out that there are different statistical tests for different levels of measurement. So while these are somewhat technical considerations, it's important to be able to categorize different variables and their attributes according to these different levels of measurement in order for us to later down the line be able to assess whether the statistical procedures used on these different levels of measurement are appropriate. So variables, to review, are operationalizations of the construct. And these variables have attributes, things that fall under them as categories. So gender has male, female, M to F transgender, F to M transgender, intersex. Those would be attributes of the variable gender. Those attributes need to have a couple of things. They need to be exhaustive, they need to cover all the categories, and they need to be mutually exclusive. You can only fall in one of those categories. And then when we have the variable and the attributes, we want to do stuff with it. And depending on what the level of measurement, whether it's just nominal or ordinal or interval ratio, we do different statistical tests with those measurements in order to determine whether there's more or less of it in whatever it is that we're, whatever analytic question we're asking. What we've been talking about so far with regard to variables is a single indicator variable. I ask you a question about your gender or your health status, or I ask you a question, for example, about your political beliefs. I could say, what is your political leaning? Are you very liberal, neutral, conservative, very conservative? That's a single indicator. I'm asking one question to assess your political beliefs. But that's not the only way I can assess something. Often, with variables like depression, or variables like quality of life or health status or any of these concepts that are relatively large, I can ask you multiple questions and then combine all of these questions in a composite indicator. And again, you see this a lot whenever you fill out surveys or assess for various things. If you work in an OBGYN place with mothers that have recently been given birth, you might ask them a postpartum depression screening questionnaire. And you're asking multiple questions, but you're just trying to assess one thing. Does my patient, does my client have postpartum depression? So multiple questions combined to assess one construct, postpartum depression. These composite indicators or scales can be used to assess many different things, and there's benefits of them. So I gave you an example just a second ago about asking, are you politically conservative or are you politically liberal? But I could ask you a number of questions that try to get at that same underlying concept, but allow more nuance and reduce my measurement error. So for example, I could ask you, should the government spend more money on social programs for the poor? Should the government strengthen affirmative action programs? Should the government take legal actions to protect LGBT folks from discrimination? And based on all of those answers, I can get a more nuanced view of what being liberal or conservative means for you. And so composite measures are often used in situations where we're trying to measure some construct that's hard to see. Depression, for example, is hard to see as one thing. I can ask you, are you depressed? You might be depressed. You might have problems with your sleep. You might have problems with your appetite. You might have lost interest in a whole bunch of things. You might be feeling worthless, have thoughts of death, have retarded movement, psychomotor retardation, or feel agitated or fidgety, psychomotor agitation. These are all indicators in the DSM for depression. And so I can ask you questions about all of those and not rely on your self-report for being depressed, but I can rely on your self-report for symptoms. Single indicators are easy to administer. By just asking you, are you depressed, it's really quick and easy for me to do. But composite indicators allow increased precision. They allow increased reliability and validity depending on the measure. And I can get a better level of measurement. Instead of having an ordinal variable, I can get an interval or ratio measurement out of composite indicators. And interval and ratio measures end up being better statistically for us than do ordinal variables. So composite measures are frequently used in situations where I want to measure some complex, hard to see phenomena where I can't just ask a simple, easy question.